Hello dear friends, I am Dr. Sunil Saini, trauma and linear surgeon, expert in limb lengthening, deformity correction, pain management. Our patient, he had limb length discrepancy, and you can see his previous video where we have done limb lengthening, that is by LON method, and 3.2 centimeter of lengthening has been done. So he was suffering from this LLD since birth, and now we have done 3.2 centimeter of limb lengthening. Limb lengthening finished almost 12 days back. So the question is when to remove the frame or when to lock the nail after limb lengthening in LON method. So many of the patients try to say that whenever there is if your lengthening period is over, they just keep on persisting ki, sir, please remove the frame immediately. But this should not be done. After your lengthening phase is finished, you need to wait at least for 10 to 12 days or 2 weeks so that the end part which has been lengthened didn't collapse. If you are in so much of hurry, immediately after completing your lengthening phase, you are about to remove the frame, then there is chances of collapse. So 3.2 centimeter of lengthening has been achieved. This patient was in our campus, in our hospital setup from last 2 months. So everything, pre-operative, post-operative, intraoperative and post-operative physio, rehabilitation, fooding, lodging, everything has been done by Global Healthcare India at Global Hospital and Trauma Center, Pataudi, Gurgaon. And today we are going to remove this frame and second surgery. This is basically second surgery, and the second surgery we are doing under spinal anesthesia. Patient is lying totally under spinal anesthesia, is totally comfortable, and we are just about to remove the frame. Prior to removing the frame, we will lock the nail, and after locking the nail, then we will remove the frame. Now his consolidation phase, he will enter into the consolidation phase. We will not allow to bear him weight immediately, but almost I am very much confident after 4 weeks, like already he has a span of 2 weeks and additional 4 weeks, then we will allow him toe touch, and partial weight bearing will be gradually started after 1 month because his calcification or consolidation phase is going very well. So you can see his post-operative. So this is a normal limb. This is affected limb, and this is the corticotomy site and ankle movement. So he is under spinal. Can you pull? Yes. So this is the ankle movement. There is no deformity at the ankle. We are just going to lock it and we will remove the frame. So prior to that, we will do some X-rays also. So to confirm how much centimeter of lengthening has been done. We have already confirmed 3.2 centimeter because if you see now, both the limbs are equal, and he is very happy that because he was not even able to wear the sandals from last so many years because of discrepancy of 3.2 centimeter. Now the discrepancy is completely over, and you can see from side se leke aaiye. So you can see the limb is now equal. Are you barabar hai? Good. So limb are equal, and then he will undergo physio, rehabilitation, and then proceed full. So friends, you can see here, this is the post-operative X-ray, and we have done the locking on the proximal end already, and this is the area just I am showing after doing the surgery now, completing. This is the callus, you can see here. Now this is the gap which is the new bone, which we call as callus or the new bone formation. This is the regenerate. And even in this X-ray, come here, please come here, near to the screen. You can see here, whitish structure, this is coming, a good amount of callus is there, it's a very good regenerate here. So this is the lengthening which we have achieved. We can even measure from this area, you can go and you can measure from this point, and we can measure this. So this is the lengthening which we have achieved. So, and then finally we have done the distal locking, which I can show you. So here is the distal holes where we have locked everything, and you can see in this image, these are the 2 holes where we need to put the distal screws or the lower screws. Now here we have put one, and in another we have put one more. So everything has been locked. This is how we do distal locking, and how we, after completion of limb lengthening, how we remove the frame. The surgery is basically done under spinal anesthesia, so nothing to worry about the pain. And at the end, we usually do some manipulation so that the ankle movements can be achieved very easily, and the patient will undergo rehab physio constant. So friends, we have done interlocking. Interlocking has been done in the distal tibia, and now we are just removing the frame. Post frame removal, we will just clean the pin tracks, and then we will do the dressing. So we are just removing the frame, and now post frame removal, we will just carefully remove the ring. So this is post surgery. Now frame is removed. Everything is fit and fine. So we will just remove the pin tracks, these pins, and then we will do the dressing. So friends, now we are just cleaning the pin tracks, and then we will do the dressing. So at Global Hospital and Trauma Center, Pataudi, Gurgaon, under Global Healthcare India, we are providing all these types of surgery. If any one of you are suffering from limb-length discrepancy, if you are having short stature and you are looking for limb lengthening surgery, we are providing the comprehensive package and most affordable package in India for limb lengthening, pre-operative, OT and post-operative. Every care is being given, including your fooding, lodging and your physio. So if you are looking for stature limb lengthening, you can contact on the below number. Thank you so much.